Hi, thank you, and it's my pleasure to be here speaking with you today about the Alexander technique. My goal for this session is that you will come away with a few ideas to take with you and start implementing about how you think about how you're moving based on the principles and ideas in the Alexander technique. I myself have classical EDS, and just a few of my presentational symptoms. I've had 2 hip replacements, I have really bendy joints, I have skin that's very fragile, and they knew me at the emergency room where I grew up because I was there every few months getting stitched up in all over my body. So that's kind of where I'm coming from. So the Alexander technique builds body awareness. So it helps you understand where you are in space, it helps you understand where your joints are, it helps you understand what your posture is like, and it also helps you understand how to change those things for the better, so you put less pressure on your joints. It's an educational method so that the focus is on your learning what you're doing and how to change that. We call people coming for sessions coming to lessons, and that we call them students, so that the idea is set up right from the beginning that you're in an educational situation and setting where you can bring more agency to what you're doing. As I said, it identifies habits and patterns for your own postural use and what you're doing, how you're approaching your body, how you're thinking about what you're doing. So we're kind of putting together the mind and the body that Helen was just talking about. One of our goals is to provide more efficient choices that you can make. So in a lesson, you're guided by the teacher to experience new things so that you can then go away and begin to choose those things that work better for you. In this way, it can then reduce pain and fatigue and help prevent further injury. You can learn better balance, put less pressure on your joints, activate the appropriate support that is needed. So just as Helen was saying, is that some things are too tight and some things are too loose. So through using the Alexander work and learning how to balance yourself better, those things that have not been online before can start to come online, and those things that have been too tight can learn to let go so that the new things can come online and help support you better. And in general, we work with overall coordination so that the whole body is looked at once, so that it's not just one joint by itself or one postural habit in your head and neck, for example, but the whole body is taken into considerations, so you begin to see how one thing affects the next. One of the nice things about the Alexander work is that it applies to everything you do. Because you're learning better overall balance and coordination, it can be applied to lifting up this. For example, it can be applied to walking down the street, taking stairs, getting in and out of a chair, which is frequently the movement laboratory that we use in the Alexander work. Is what you're doing when you're getting in and out of a chair reveals and helps you understand how you're using your overall coordination in any activity that you do. So the focus is on the how, on how you're moving, what you're thinking, how you're approaching your own body, and then how you put that into action. And the idea, again, is it gives us our own agency in moving. So we have actually something to do with what's going on and how we're moving. So what is good postural balance? Here I am working with one of my EDS students, helping her find her best balance while she's standing and beginning to take a step. One of the important ideas is that we become adaptable to the movement in the moment, so that we don't try to fix ourselves and then move from that place and hold ourselves in a position. We want to allow the body to move dynamically so that each time we take a step or we move to sit down or stand up, everything is doing what it needs to do in the moment. So we allow ourselves to adapt to everything that we're doing right in the moment. We're looking to find stability within our instability. So that means that we're going to find a balance that works for us and find a way to move that will help us keep that balance while we're in motion. I find that a lot of EDS students are really sensitive to their movement, mostly because we have to be paying attention all the time already so that we can not allow things to sublux or move out of joint or cause pain to ourselves. So it's really important to learn what you can think about that makes the most difference for yourself, how you're thinking about what you're doing in finding your best balance in your movement. And looking for this movement flow in the idea of spatial relationships to your own body parts, we're going to talk about that in a minute, and to your environment is really important. What I found that being clear about your spatial intention is really what helps with your understanding about how you're moving. So what you think makes a difference. First of all, you have to be thinking. That's the beginning part. You can't just go on automatic pilot and just expect yourself to make changes and not potentially fall down or get injured. It's important to recognize that as you think about yourself, you remember that you're a three-dimensional person. I mean, this may sound obvious, but because of mirrors and videos, I think a lot of us have started to think about ourselves as sort of like a paper doll that just has two dimensions and doesn't have depth and width and height and length. You can think of your body as a suspension system. Now, there's a whole theory called the tensegrity theory. I have a prop. Where you can think of your body as a suspension system where your bones are the spacers and your ligaments and muscles are the compression, tensile forces that hold yourself in your shape. Obviously, you're not this shape. We're not this shape. But the important part about this is that there's a recognition in this kind of a paradigm for yourself that every time you move, right, every time you move, the whole structure actually is affected by what you're doing. So as I pull on this kind of ligament here, it changes the whole structure. In the same way, when I push down or there is compression, the whole structure is also compressed in this way. Right? So this actually is to our benefit so that we can then understand that everything is going to be supportive. Our whole body is moving all the time. We're whole body movers. We're not just movers of, for instance, a knee moving forward. That's going to affect the whole system, and we want that so that we can dynamically balance all the time. So in this way, for instance, with this paradigm of suspension and whole body movement and understanding, if I pick up this bottle of water, as I take the weight of the water and I let myself dynamically balance, I can experience the weight of this water all the way down to my feet. It comes all the way through my system, and then I can support it with everything. I'm not just trying to support it with my hand or with my shoulder. That actually makes my shoulder hurt when I do that, if I grab it too tightly. If I get a sense of support for the system and consciously intend to let my whole body support the water, then I can allow myself, then I can mechanically support it in a much more conscious and even way. When we find this whole body use of in our awareness, we can then tap into what's called the ground reaction force. So there is a force that's pulling us down into the center of the earth, right? We all feel that probably. And there's also a rebounding support that comes back up through our system. We have another prop here. This also is not our shape, but it demonstrates the ground reaction force so that when I drop the ball, there's something in this structure that lets the bounce come back up, right? We actually have the ability to experience that rebound in ourselves when we get aligned well and allow that force to come back up through us. Then we can get a sense of lightness, a lack of compression on ourselves, and a sense of ability to further our ease of movement and take away some pressure that are on the joints. Let's see. So I have taken this slide from Dr. Pradeep Chopra's presentation that he's given to show you the effects of posture and what happens when you allow yourself to let your head go forward. He shows that as you let your head go forward, even just a little bit, there's a lot more force on your back and a lot more muscular use that's needed to balance yourself on your body well. So he calls this the chin poking head forward syndrome, chin poking forward syndrome, which you can see is kind of dramatic when you get going, when you let your head go forward away from yourself. He calls that the chin poking forward syndrome, but in the Alexander work, we would call this the head going back and down. And you can see right here in the back here where your head is compressing in the back of the neck. In a way, the head is actually going back and down. The chin is still poking forward, but one of the main things that's happening is you're getting pressure in the back of your spine, right at the top there. And that actually is sending weight right down your spine into the floor, making you feel heavy and compressing. And as you'll see in the next bit, there are lots of compensations that then happen throughout the rest of the body if you let your head move forward like this. So one of the things that is important to understand about change is how to make that change. And this is something that you can do in the moment all the time. The first thing is to pause where you are, kind of recognize what's going on, think and redirect yourself with your spatial thinking, with your awareness of what will make things better, and then allow for the movement to come with that recognition and those thoughts, right? We're going to look at specific examples of that in a minute. So then the more you repeat that process for change, the more you can change your posture for the better. Okay, here's one of my students. He doesn't happen to be hypermobile, but he's a good example of how this kind of thinking can change you. The picture on the left is what he used to look like when he played the guitar. And this student came to me with lots of pain in his neck and his arms, and you can see why. He plays in Broadway shows and plays eight or nine shows a week. And after about a year of Alexander lessons, once a week, his posture has now come to this, and he's able to play his guitar with this better posture. He's almost completely out of pain and has lots of strategies for using when he's in the pit playing his guitar and when he's, walking down the street and doing all of his other activities. He was unable to do the dishes for a long time, things like that. So he was in pretty severe shape when he first arrived. Here is a colleague of mine who is hypermobile in her back. On the left, this is what she looks like when she's not paying attention or thinking or considering her posture. Now, she thinks about this all the time so that she can maintain and improve herself, but now the picture on the right is way more like what she is on a daily basis. You can notice that if she has these spatial thoughts, which are internal spatial awarenesses, if she takes her head away from her feet and her feet away from her head, that's what's happening spatially. She can think of the top of her head toward the ceiling, which actually gives her a reference point for the room in the top of her head, which orients her in the space. She can lengthen her back, right, so that her back supports her. That would be the tailbone going away from her head and the top of her spine. She can unlock her knees or have easy knees. This kind of, I find that with a lot of EDS students and myself, that locking the knees is kind of a go-to thing. We sort of sit on the joint, and that actually, you can see, brings her head forward here. And what I recognize happens as we sort of stop sitting on our joints is we often go through a wobbly period. We go through a period of, oh, I feel way less stable. That's almost a part of the process of finding more stability, because through that wobbliness, you're going to find this ground reaction force that's coming up through you, and you'll be more stable in the end, but sometimes it feels for a little bit of time that you're less stable than you were. It's part of the process. Here's another one of my students who has EDS. On the far left picture, you'll see this was his pattern when he came in. It's actually not as severe as it was to begin with. He is looking down. His head is, this is what he's doing when he's trying to be good, right? This was his go-to good posture. And his head is tilted forward, his eyes are looking down, his chest is poking up. You can't see from his shirt, but he's a little bit arched in his back. And this man is a professional singer, so you can see that if his sternum is forward, he's not getting the breath into his lungs in the back, which he desperately needs to sing. So then that made him do his pattern more because he was trying harder, right, to do the right thing. Here he is when he gets tired of trying to do the right thing and lets go into his good old slump, because he can't hold that proper posture very long. He gets too tired. And then you can see what happens. He also looks like he gained about 10 pounds from just letting himself sit on himself. And here he is now after about a year of Alexander work, year and a half of Alexander work. So he's now able to be like the picture on the right most of the time. He has had a lot of shoulder pain, you can imagine that, and a lot of forearm pain and a lot of lower back pain that now seems to be going away as he starts to regroup with his posture. So here are some practical postural suggestions to reduce your leaning or sitting on your joints, right? And to allow yourself to go through that wobbly part when you may feel like things are more unstable. You'll eventually get to this as you use your spatial thinking to find a better balance for yourself that can be used in every activity. And that is what we're calling dynamic balance, something that changes as you move, right? Sense your three-dimensionality consciously. Sense that you do have length, width, and depth. Take time to rest. To know your anatomy. You don't have to become an expert in anatomy, but it's really useful to have a good sense of where your body parts are, where the joints actually are, have a good mental image of them, and also have a sense of how you can embody that understanding. I put this picture of the head and neck up on here because when you ask people, for instance, where they think their spine ends, most people, and I've actually surveyed a number of people, think their spine ends at the bottom of their jaw. So they're trying to move their head and their neck from that place. And you can see from this picture that the spine actually comes up behind the jaw. You can also see that there's a lot of head behind that balance point of the head on the spine. So the reason this is important is that if we have an inaccurate image in our head about where we're supposed to be moving, we're sending messages to that inaccurate place from the brain, and then we're moving from there. We're trying to move from the place where we're not meant to be moving from. Does that make sense? So I would be moving my head from here if I thought that, rather than from the very top part of my spine up there. Do a little experiment right now where you are. But before that, notice one more thing about the head and the face is that you can think of the back of your head, right, that as counterbalancing your face. So there's, when you go to move your head, there's always the back part that's counterbalancing the front, and vice versa. So just to get started with where this top joint is, you could put your fingers up here if you want to, right up underneath your ears, and then very subtly, because not to disturb anything that's going on there, just let your eyes look down at your knees. And notice that that starts the movement of your head going forward from that very top place. And then look straight ahead again, and you can notice that there's movement right at the top of your spine. So if you start to do your yes motions from up here and your no motions from up there as well, you're going to take a lot of pressure off the rest of your spine, as we saw from the Pradeep Chopra slide. This same kind of anatomical understanding is useful for the rest of your body. But another big example is where people actually think their hip joints are. Many people, put your hands on your hips, and commonly people put them up at the top of the pelvis. The joint is actually down at the bottom, and it's actually more medial or central to your body than most people think. So if you go to sit down, for instance, and you're trying to move from the wrong place, or you don't have an accurate idea of where that is, or a sensory experience of where that is, that's what's going on. You're putting a lot of pressure on places where you're not meant to be moving. So one needs to cultivate curiosity about how you're moving, where you're moving, how you're moving, taking a look at those habits that we have. We need patience with ourselves. It takes time to make change. We need to continue to build awareness. We need to pay attention to the whole, recognize that each movement that we do affects the whole, and everything we do to improve ourselves will also affect the whole, will help the compensations. We need to look at our overall balance, and we need to allow things to take time. Some everyday applications, you can make sure that your workspaces are at an appropriate height for you, that you adjust storage levels, that you find a handbag that works for you, which is a never-ending search, and you can take lighter loads. Plan ahead when you do something, avoid rushing. Locate elevators. Make sure you're going to some place where you know you can function well in and can accommodate you. Wear easy clothing and have your necessities available so you don't have to contort yourself when you get to the train to find your Metro card. The Alexander technique is often taught in private lessons and in group classes. It usually includes gentle hands-on guidance, verbal instruction to help you understand what you're thinking and how to change your thinking. It helps you use your mobility aids, and it helps you learn adaptive movements so that it helps you do your daily activities in a way that are less risky for you. Here's a slide of one of my students working on someone else in a very gentle way. In summary, the Alexander work gives us a practical way of working with our conditions. It connects our strategic thinking with our activities. So it really helps us figure out how to think about what we're doing. It demonstrates that small changes in our thinking can go a long way toward our overall improvement, that it applies to everyone in every activity, and it considers the whole body with parts in relation to the whole. So again, the process for change is to pause, think, reflect on what you're doing, think about something spatially that's going to help you change how you're moving, and then allow yourself to move from that better, easier place. And if we have time for a couple of questions, that's good, or do you want to wait till we're both done?
We do it at the end.
Okay, that sounds great. Good. Thank you.